Adderall is a prescription medication. It's a stimulant used to treat ADHD. It's probably the strongest one out of all of them. It increases serotonin, norepinephrine, and dopamine. It's a controversial medication because it's addictive. What we mean by that is that it creates tolerance, which means that you need more. People tend to have a hard time coming off of it, and you can get withdrawal symptoms. That's what we mean. So when I think of medications like this, and it's that controversial and could potentially cause some harm, especially as it relates to children who potentially have ADHD and need a medication like this, I'll just look to the data as I always do. And one of the biggest studies that comes to mind was called MTA, which was the multimodal treatment of children with ADHD. And they basically broke it down to 4 different categories. So for one category was people who took medications for their ADHD. Another category was people who did therapy for their ADHD. And the third category, they combined medications and therapy. And the fourth category was assigned to basically whatever treatment was available in the community without the help of the study design. And what happened is what you would expect, actually, which is that the group that took medications and therapy together did better than all the other groups, essentially. So this was really a landmark study. It did have its flaws, so there was no placebo group, which is normally a standard in clinical trials. It didn't have that. It also didn't really account for longitudinal follow-up on the patients, but although further studies did, and probably was a little bit more skewed towards the male gender as well. So it did have some flaws that have to be taken into account, but really this was a landmark study that catapulted other studies that confirmed, for me, really what we've always known, which is you combine medications and therapy together and you're probably going to get better results.